Good Friday, everyone. I would like to talk about pharmacy law today. Um, a lot of patients and some pharmacists confused about pharmacy law every day, especially um, retail pharmacists uh, and people who work um, at the chain pharmacy like CVS, Walgreens, Walmart. Um, they face with the pharmacy law every day. So I would like to talk some important pharmacy laws that may be benefits for both patients and pharmacist folks. So I would like to talk about Schedule 2 to 4 controlled substance prescriptions. Schedule 2 uh, is different with Schedule 3 and Schedule 4 and Schedule 5 and the prescription only. So the Schedule 2, like oxycodone, um, you know, hydrocodone, morphine, uh, those medications, controlled substance, Schedule 2 or C2 prescription. So first I would like to discuss about day supply. Okay, so excuse me. So the day supply of C2 prescription, um, the maximum day supply for the C2 prescription is 30 days. But for some C2 medication, the maximum day supply can be 60 days, like for those medication for the dextroamphetamine or methylphenidate for the ADHD. So those medication um, can be 60-day supply. And some injectable infusion medication during the bumps, um, they may be okay for 90-day supply. So for these day supply limit is a different and vary state to state. So may need to check with your state law to see what are they supply limits for the Schedule 2 prescription. And the Schedule 2 prescription cannot be refilled. It's prohibited. So no refilling for Schedule 2 prescription. For some reason, prescription for Schedule 2 might be partial fill because they don't have enough medication in stock, so they out of stock medication, and in that case, the pharmacist may give you some partial fill, but it's very complicated to do the partial fill Pharmacists need to um, dispense the rest within 72 hours, and if after 72 hours the patient not come back for the remaining, then the pharmacist must report to the prescriber, the doctor who prescribes the medication. This little, it has some a complication if something happened after the buzzer fill. And then it not permitted patient request, so the patient cannot request a buzzer fill. The buzzer fill only occur if the pharmacy does not have enough medication in stock. So how long the prescription, the Schedule 2 prescription is valid? Depend on state. Some state, it set the time limit like 30 days limit. After 30 days, the prescription is no longer valid. So you may need to get a new prescription for C2 medication if you cannot fill medication within 30 days. But for some medication, for some patients, like patients in long-term care facility, like a nursing home patient, or patient with a diagnosis of terminal illness, and the prescription may be valid up to 60 days from the day of issuance. So for the patient, the prescription can be filled within 60 days from the day the prescription was issued. So this is very important numbers and informations when you have the prescription for Schedule 2 controlled substances. You need to know some basic information to avoid, the prescription become invalid, and make sure you get enough medication, the total quantity, prescribed instead of a buzzer fill. If you don't get a buzzer fill within 72 hours, then you cannot get the rest of the medication. And remember to fill the medication within 30 days. No refills permitted. And then understand the state laws to make sure, if you have the prescription for dextroamphetamine or methylphenidate for the ADHD, and some injectable infusion bombs, the medication for infusion, then you need to make sure you fill the medication within the time limits. All right, if you have any question, please let me know in the comment below. I'm going to talk a little bit about Schedule 3 and 4 prescription. So Schedule 3 and 4 prescription. There you go. Schedule 3 and 4 prescription. So again, the day supply, or state law, some state law is the maximum 30-day supply per single filling, or be spent at one time. Federal law say maximum 34-day supply per single filling. But only a 5 refill and 6 months. You only have 5 refills within 6 months from the day of issuance of the prescriptions. So after 6 months, you cannot fill the Schedule 3 and Schedule 4 prescription. Make sure you know the time limit. And only fill 30 days supply or 34-day supply per single filling. Okay, so as long as you have enough for medication for 6 months, if you have 34 days supply, then probably you don't have 5 refills, maybe 4 refills. So it might be we need to do some calculation of for 6 months is equal 24. Probably you have 4 refills if 34 days supply. For box refill, yeah, if the pharmacist unable to supply the prescribed quantity due to out of stock or the patient request, so it's different with the Schedule 2 or C2 prescription. C2 prescription, the patient cannot request a box refill. Okay, and then for state law, you might not exceed 30 days supply, and the total quantity in all box refillings may not exceed the total quantity prescribed. And then after 6 months from the day of the prescription issue, you cannot do a box refill or any refill, nothing after 6 months. Again, the prescription may be valid for up to 6 months from the days the prescription issued. So this very basic but important information all patients and pharmacists should know to avoid any arguments when the time that the patient needs medication but cannot be filled, or too soon to refill, things like that. Generally, pharmacists may dispense the schedule prescription maybe only 2 days earlier if the patient want to get the prescription too early, they only do 2 day, 2 days early for most of the scheduled substances. All right, so this is some pharmacy laws that it's occurs every day, and then you know some a lot of patients they don't understand this why the pharmacist refuse to refill the medication too early, or why they cannot fill the prescription even though they have some refill remaining like that. And the pharmacist, the healthcare insurance may have some information. For example, if you fill the prescription multiple pharmacy, uh, your insurance may let the pharmacist know that you already fill this medication from the other pharmacy. So the pharmacist will know if you already got the medication for the pharmacy. Right? If you have any question or concern about this pharmacy law, please let me know in the comment below. Thank you for listening. Oh, I'm going to continue some very important pharmacy law. This is just for patient information. Good to know this information when you have a prescription, get it filled at the pharmacy. So the last time I talked about Schedule 2, Schedule 3, and Schedule 4 controlled substances prescriptions. Now Schedule 5 controlled substance prescriptions, or C5 prescriptions. Again, you need to understand the day supply on the prescription. So no federal or state law regulating the quantity of this prescription, C5 prescription, or Schedule 5 controlled substance prescription. So no law saying how many they supply. I need anything filling any one time. For the refill, no specific or set time limitation. So for the C5 prescription, the law doesn't say how many days supply can be refilled. It's not like C C3 and C prescription, it limits to 30-day supplies. So, but many states, may limit refills of C5 prescription by refills within a 6-month period. It's like C3 and C4. C3 and C4 it limits to 5 refills within 6-month period. So it depends on where you live. Your state may want set the limit, set the time limitation C5 prescription. The C5 prescription may be partial fill. So there is no law regulating partial fill for C5 prescription. But the total amount of all partial filling but not exceed the total amounts required. And when the prescription is expired, it's no specific or set time for expiration. So many states consider the C5 prescription is similar to C3 and C4 prescription, C3 and C4 prescriptions. Then the prescription may be just valid for up to 6 months. It was issued. So it still depends on your states. Okay. But if your state has no specific or set time for expiration, then the prescription might be valid for 1 year. But most of the insurance company and the pharmacy system is set up for 1 year cut off for prescription. In other words, the prescriptions become invalid after 1 year which were issued. This is very important information for you as the patient understand, why they give you certain day supply, and usually for those states who have no regulation on the C5 prescription, then they might fill up to 90-day supply. It's just like regular prescription medication due to 90-day supply. But if it consider C5 prescription as the C3 and C4, then it might only give you 30-day supply. And again, check your state regulation to see if you can refill the prescription beyond 6-month period. And most of the prescription is not valid after 1 year. Those very important limitation of the prescription. You let me know if you have any question for the Schedule 5 controlled substances, prescription, or C5 prescription. Thank you. So the last part of this type of pharmacy law is prescription only prescription. The RX only prescription, or some states they say C6 or Schedule 6 controlled substance prescription, either RX only prescription or Schedule 6 controlled substance prescription. So the day supply, so no law um, talking about the quantity maybe dispensed at any single filling. So most of the insurance limit for 90-day supply. For people who travel overseas or something like that, might request 6 months supply. But like I say, most insurance companies limit for 90-day supply for prescription only medication. And then some medication, it's very dangerous to dispense over 3 months supply, like over 90-day supply, medication like antidepressant or antipsychotic. Those medication, they might limit to 90-day supply maximum, like medication like a Seroquel or Lexapro or some medication require to monitor your blood like Coumadin or warfarin. Those medication, they may not give you more than 90-day supply. That is the patient safety, not about insurance, not about the money. That is the safety. Most of pharmacists or the doctor, they don't feel comfortable, they are not comfortable to dispense more than 90. For the refill, there's no specific set time limitation, but many insurance companies and pharmacy systems set for 1 year. After 1 year, you probably need to get a new prescription, or the pharmacy folks, they may call your doctor office to get a prescription renewed. Partial fill is permitted, however, the total amount or quantity in all partial fillings must not exceed total amounts prescribed per prescription. So when the prescriptions expire, I just say valid for up to 1 year from the days we issued from many insurance companies and pharmacy systems. No transfer of refill for the prescription only beyond 1 year from the day of issuance of the origin of prescription. So, the pharmacy cannot transfer your refill to a different pharmacy if the prescription beyond 1 year. So after 1 year, most of the prescription is invalid of insurance companies or pharmacy system. You may ask a new pharmacy call your doctor to get a new prescription or get the prescription renewed. That's all you can do. That the old pharmacy cannot transfer your expired prescription, to a new pharmacy. So this is very important information for you as a patient to understand how the pharmacy fill your prescription at local pharmacy. When they get your prescription, they look at the day of the prescription were issued, and then the day supply, the prescriber or the doctor want, and then some prescription, they, like some chronic disease, you might request 90-day supply, like high blood pressure or diabetes, high cholesterol, those disease, those medical conditions, a chronic medical condition require you to take for a long time, then you might request 90-day supply for your convenience. Then most of the pharmacists accept that request from you. You don't have to ask your doctor for that. You can ask the pharmacy to fill a 90-day supply as your request. And then you should know the most of the prescription is invalid or expired after 1 year. Then probably you need to get a refill before that. Otherwise, you need to have the pharmacist call your doctor office to get the prescription renewed. Some medication require you to see your doctor before they can renew. Most of the medication, within your mental health condition, like depression or anxiety or the psycho problems, and you need to see the psychiatrist before you get the prescription renewed. Or some medication require to monitor your blood, like Coumadin, need to get the lab blood test draw before they can renew your prescription. And like that, you need to work with your doctor. The pharmacy cannot help you with those things. And within 1 year limit, the pharmacy can transfer your refill to a new pharmacy. For example, you got prescription with 11 refills, and then the prescription after 6 months of the day of insurance of the original prescription, then the pharmacist can call to a new pharmacy get the prescription transfer. But after 1 year, they cannot do that. The prescription is no longer valid in their pharmacy system. I think most of the pharmacy set the 1 year cut off for the prescription only medication. All right, so that's all about the prescription. From C2, C3, C4, C5, and C6 prescription. C6 prescription is the regular prescription or the RX only prescription. Each state they call different. And so you may have to check with your pharmacy, your local pharmacy, to see how they call the Schedule 6 controlled substance prescription. Sometimes they call the RX only prescription. Sometimes they call Schedule 6 prescription or regular prescription. If you have any further question or any concern, please let me know. I'm willing to explain pharmacy law. If you confused or if you don't understand anything about pharmacy, please let me know. I want to clarify or make sure give you the good information that can help you understand why the pharmacy give your medication, why sometimes they don't. They review your prescription. Thank you. Have a good one.
Some of my keep asking different goal. I know. So when you go to Google and go INR, there's here is a basically go up INR or the full range of INR is between 2 and 3 most indication, except for the mechanical mitral valve replacement or mechanical heart valve INR 0.5 to 2.5. That's correct, but also the other special INR is 2.5 to 2.5, and not only way by the mechanical heart valve. Sometimes if people who have deep vein thrombosis or DVT or the AFib, that cannot be controlled by warfarin with the go-to-3. For example, people have been taking warfarin with the INR rank between 2 and 3, but still have stroke or still have recurrent DVT or PD. They may increase the INR range to 2.5 to 3.5. Make sure they're not having stroke or the recurrent DVT or PD when they are at therapeutic level. sometimes they have the patient additional medication like aspirin, then the current DVT, OPE, stroke, and take over. And sometimes some people very high risk of bleeding. They may want to have those patients a lower INR range, maybe have to be below 1.8. Sorry, maybe 1.5 to 2.5. So for those people, they are very high risk of bleeding. Have any further question? Is how in vegetables. So you should eat some greens, but you need to be consistent with your vegetables. You should eat same amount of vitamin K or same amount of greens every day to make sure your warfarin stable in your body. You have to eat consistent. You need to know how to measure your vitamin K, for example, spinach or kale contain a lot of vitamin K. So if you eat, I would recommend that you should eat low to moderate amount of vitamin K. So if you eat half of a raw spinach for one day, the next day you should eat like 2 or 3 cups of raw cucumbers or tomatoes like that. But dark leafy vegetables or dark leafy greens contain more vitamin K, like kale, spinach. Light vegetables contain less vitamin K, like cucumber or tomatoes contain less vitamin K. So I would recommend that you should eat low to moderate amount of vitamin K, but you must be consistent every day to make sure that your warfarin stable stabilize in your body. Generally, when you see this question, can you eat food with vitamin K on warfarin? Yes, I would say yes. You can eat some food with vitamin K, but you must be consistent and you should know how to measure the amount of vitamin K in each food in order to make sure you eat a similar amount every day. What foods should be avoided when taking warfarin? Well, I don't think that you need to avoid any foods when you're on warfarin, especially the food affect your warfarin like greens or vegetable. But some foods, may affect your bleeding, like garlic or some other herbals it may increase your INR, so it may increase your bleeding. So I try to avoid those medication may cause bleeding. The vitamin K does not increase your INR level or does not raise your INR level. It decreases or it lower your INR level. So what it means when it's low INR level? So when your INR low, you are at increased risk of blood clot. When your INR level is high or critical, is increased risk of bleeding. That is why you have to make sure your INR stable and in the range. There are two typical range. One, the normal range for certain medical condition like EVT, AFib, the normal range between 2 and 3 for the INR. For mechanical heart failure, the INR level is between 2.5 to 3.5. So it depends on medical condition. You have a different INR range. You have any further question on this topic or the issue? Please let me know in the comment below. Thank you.
Hello, Yati. This is a good question. What is the difference between both Tylenol? I say Motrin is a non-inflammatory steroid drug. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps, like that.